na me ne Urumanyam for Dr. Thomas Anaba MP Edema Garu yenhwe de course wo Rich Hospital. Honorable Anope Wotem Nkan. Good morning. A long time. Between catch papa.
Good morning to you and good morning to the cherished listeners of Ahuto FM.
Okay, my man, and was saying, I can't reach it. Yeah, about Kwasema. Now you can Dr. Thomas Anaba. His son said, "Wa breso, woman train ama rage. Now you 10 key projects. Woman train cry, and you won't concern. MPP are buying wo usi abonti. Woman kasa kwasa Dr. Fobegumu say facility no. After the man paying say engagement. But currently, issue on say nra nenansa ene tutrase bi course or hormone. Now, the Ghana Medical Association, what about the statement on the Ababontin calling for justice, stronger protection for health workers. Now, within our health status, yedim rebia umo etimi bo a doctor for a nurse for midwife for and answer any obia or ye juma in line with providing frontline health services. Yedim rebia bo mo bai.
Your tree was very strong.
So, my main Danimuka Krenko Potokasem. Now, the Ghana Medical Association and some stakeholders are calling for stringent and deliberate, your friend is saying, punitive sanctions against Omomndra and Nenansa. Omokoye good. And Amibusa said within our health status, and they, you need any provision via some form of security, any protection for our frontline health workers.
Oh, thank you. I think as for security provision in hospitals, we have security. But we don't have that security for very aggressive people who may come to the hospital. Because a hospital is not a place for you to go and be attacking people and the rest. People go there to save their lives. And we understand that anybody coming there should be coming to at least seek for help for himself or his relatives. Security is provided to take care of the property and then the rest so that people do not steal the property of the hospital and to safeguard people who are coming, minor aggressors or somebody who is angry, they try to persuade him and move. But the extent at which we saw the day before yesterday, I don't think that security is not provided in any hospital for such things. No, I don't think we have, because it was way above what we anticipate may happen in a hospital. We can put an armed guard in hospitals waiting for people who are coming to disturb workers there, because we think that all those working in the health sector are people who are doing sacrificial jobs to save people's lives. So no one will attempt to come and molest them the way it happened the day before yesterday. But for security, general security, the normal general security, we have it. Yeah.
Now, Yemra, the issue on customer satisfaction within our health centers. Saying and also so say a nurse for a doctor for BBR provided health service for the society, for the community, for the ordinary Ghanaian, ought to discharge the duty without any form of intimidation or favor.
No, as for that one, it's established. Healthcare, we those who graduate as health workers, we are vowed to serve even our enemies and serve them well. So there is it's neither here nor there that you should joke with somebody, provide let me say, unqualified service or provide superficial service to somebody. You have to provide standard treatment to every patient who comes there, give him the needed customer care services so that he goes out happy. It is for that reason we have rules guiding the hospitals. It is for that reason we have what we call the Medical and Dental Council, the Ghana College of Nurses and Midwife College, and then the rest, to regulate the practice of medicine, nursing, pharmacy, and then the rest in our hospitals. So if you have a client who comes and is not satisfied, there are places you go and report. We have the customer care service department in most of our regional hospitals. Enrich Hospital has one, a customer care unit, where when you believe the treatment given to you is substandard or is unacceptable, you report to them and they will take the case up for you and handle it. That is what is established. And if you think that the treatment method out to you has been wrongfully applied and you have been injured, due to the service given to you, you can report it to the hospital management and what we call the Medical and Dental Council or the Nurses and Midwives Council when you think that you have been mishandled or treated wrongly. That is the process that is established to handle unfair treatment in hospitals.
Right. Now, there is a statement from the Health Ministry signed by the Deputy Director and spokesperson, Ora Tony Goodman. Now, let me take you to paragraph 6 before 7. Or say he assured, that is the minister in quote, management and staff of the ministry support and protection. But my minority of parliament seemed, not convinced regarding this particular roadmap by the minister or Diego Jose to ensure Sir Wadini ABC Assembly.
I don't get that paragraph very well.
Right. Okay, the entire statement so that coherence in the Now, the headline reads, Ministry of Health condemns the attack on the health professionals at the Greater Accra Regional Hospital, which is RAGE. Now, one, the Ministry of Health has taken note of the unfortunate incident that occurred at the Greater Accra Regional Hospital RAGE Emergency Department and categorically condemns the acts of interference, aggression, and assault on health workers. Two, the ministry views this development with utmost seriousness, such that actions compromise the delivery of critical health services and endanger the lives of both patients and healthcare providers. Three, as a matter of urgency, the ministry is taking immediate steps to 1. Beef up security at the Greater Accra Regional Hospital to ensure safety of the staff, patients, and the general public. B. Investigate the circumstances that led to the reported delay in the care and address any gaps that may have contributed to the incident. 4. The ministry reiterates that safety and protection of healthcare workers remain a top priority, and it will not tolerate any acts that threatens their well-being or distract essential health delivery. 5. The Minister for Health, Odumoyanfo Kwabena Akando, has since visited the hospital and has been given a first-hand information. 6. He assured management and staff of the ministry of his support and protection. 7. We call on the general public to exercise patience, cooperation, and mutual respect at all times to enable health workers to provide effective and timely care. Now, Anamibusa say, with all the steps I go acquire, so the minority in parliament seem not to be satisfied. I'm calling for proper due process and punitive sanctions against the perpetrators.
I don't think they are in disagreement. The minister has already stated that they will investigate it. He has been there himself to see what has happened. He has promised to provide security for them. He's saying that after the investigations, those who are to be dealt with will be dealt with. I don't know what they are not in agreement with. I don't know what is wrong with what he has written. That is what he should write, and that is what should be done. And that is what the hospital is doing. It's unfortunate it happened. And as I told you from the beginning, no one will go and put armed military men in the hospital to take care of hospitals if there is no state of emergency. This normal security can be provided, but if something like this happens, to prevent it, you enhance security for some time and later on win them off. So I think the minister has done the right thing. Let's allow investigations to take place. Look, what happened could have caused somebody even to die. If we are just lucky that no one was rushed in under code red. You know that in hospital emergencies, we have codes for every patient who arrives. The moment you land at any emergency in a hospital, they will have to assess you the way you are coming in, how you are brought in, whether you are brought in a wheelchair, in a bed, in a trolley, in a stretcher, or you are walking and coming in. And they will assess to see whether you need immediate care or you need a delayed care or you need an afterward care. Then they can code you into red, which needs immediate care, code you into yellow, which needs, you can wait a little while, and code you into green, you can wait for an hour or more. Because you don't have 100 doctors waiting for one emergency to come for them to take to them. You have few doctors, so you must code everybody. It is like that internationally. So when you come in green and expect that they should see you immediately, when they already have somebody in red they are seeing, you will not get the attention. Because the first nurse who met Ralph attended to him and told him to get a card, meaning that he was categorized as what? As green. That is how I see it. And the protocols are there. It was categorized as green. So you can wait. You can go and do a folder and come. Before we even attend to you, get sutures and then the rest, and suture your hand, which you said it was bleeding. That is fair enough. But Rav went ahead to start making noise, recording and shouting. Even you could see a patient on a bed indicating to him that he shouldn't record him, stopping him, but he refused and recorded him. He violated his privacy. He violated the privacy of all the patients who were in the emergency, which is not correct. As I've told you, if you are unsatisfied with the hospital's management, go to the customer care department, report them. But you don't make noise in the emergency, scare everybody. Now you went to beat people. If they have brought somebody in red who needed emergency treatment, the people you made them to run and leave the emergency, who will be there to treat the one they brought in red? No one will be there. So what they did really deserves serious punishment. But luckily, in the statement of the minister, all that has been spelled out that they will investigate it. Investigation doesn't mean that when they look at it and finish, they will allow somebody to go. Definitely, the police is aware. They have been reported to the police, and the police will do their investigations. If there's anything that is criminal in nature, they will handle it. The other civil issues, they will handle it. So to me, it is okay. The letter is fine. The minority, I don't know what they want to add. They can join the minister. We don't mind. They can join the minister to help him add what they want to add. But we are all talking, saying the same thing. People must be held responsible for causing chaos in our hospital.
Right. So finally, now we are learning from the health, the rich hospitals say woman withdraw critical emergency services. Now, with this posture, any form of appeal to their conscience say woman made me say edwuma say the okan ye no eto de bia na koya tani ata foma na ose bi mo fom na baby and brand dance so it's bitimi editor. Now you from Parliament Health Committee and as a medical doctor, I do say emotions, how do we address issues about emotions?
Oh, I think if they are afraid of the place, it is like the minister said, provide enough security and allow them to come and work at a very safe environment. That is what. Because you don't know whether another group of people will come and attack or not. All this is caused by one person. Just because his finger was bleeding, it's caused by one person. I'm not saying our hospitals are perfect, 100% perfect in anything. But look at what he has done. If these nurses and doctors refuse to work at the emergency for fear of their lives, what will happen to other patients they will bring? Already we are having challenges at our hospitals, emergencies, bed issues. And you go and add this. You make it worse. So I think the attitude of Rav was not good at all. He didn't do well at all. And this must not repeat anywhere. Our appeal to the nurses and doctors that they should allow the ministry and the hospital management to provide them with the needed security from the police to man the place. Then they provide services to those disciplined patients who unfortunately land in their hands. They shouldn't withdraw their services. It is not good for them to withdraw their services. The government can provide security for the hospital. And I think that can be done immediately.
Okay, my name was Dr. Thomas Anaba, MP, Edimadishomo Garu, member on the Health Committee of Parliament. Why? First, no to me frame, you be doing Comosa, obey implementing on Cabio.
Oh, yes, I do.
Wait, at you for until into the infant.
Okay, that was it.
Right, I mean, I was saying, Dr. Thomas Anaba.